are there generally specific drugs that you recommend for people with heart disease?
I think that's a pretty broad question. Again, given that heart disease is a pretty broad catch-all. For people who have coronary artery disease or arterial disease, I recommend an aspirin and a statin for everyone. And the American College of Cardiology and American Heart Association guidelines would endorse that as well.
Fair enough. That makes sense. Thank you. I do have another question, and that is, are there nutritional supplements, vitamins, minerals, powders, probiotics that you might typically recommend for those cases as well?
For which cases? I apologize.
Well, for people with heart disease, but you had mentioned, that it's a broad spectrum. So I don't know if there's any, generally speaking, do you predominantly recommend any of those types of things?
In patients who do have heart disease, I don't typically push any particular supplement. I use what has evidence based behind it.
Okay, excellent. Well, I would say at this point, I think we have fulfilled our cue. No, I was going to say I think we're done with questions, and looks like I have one that just came in. So let's go to Alejandro. Welcome, Alejandro.
Hi, thank you for that great presentation. That was great. I felt like I was in the driver's seat from like all of your experience as a doctor. So thank you. And my question is there any information you can share as far as the effect of vegetable oils versus saturated fats on cholesterol and blood pressure on the arteries? Do they both affect your cholesterol levels? Is one worse than the other? Say, for example, compare a steak with like a processed snack with vegetable oils. That makes sense?
It makes sense. And it's hard to drill down, a specific food's effect. But in general, I can tell you that saturated fats tend to raise the cholesterol levels significantly more so than say, a vegetable oil would.
Okay, thank you.
Thank you for that. And we also have another question coming in from Dave. And welcome, Dave.
Thank you. Hi, doctor. Great presentation. You might have covered this and I missed part of the presentation, but I have a quick question as far as I eat healthy, I exercise, I get enough decent sleep. Number one, do you recommend any other tweaks that you think like on your daily schedule that would improve our, long-term health that you didn't cover that you could think of? And then how much would you say is stress a bigger factor than your food consumption, or is food the primary, what's contributor to heart disease?
It's a good question whether stress or food is more important. I think it really depends on what the stress is, certainly. And it's hard to quantify stress, but I think both eating a healthy diet and managing stress are very important for not just heart health, but overall health. As for what I may not have mentioned in my talk about healthy lifestyle, and I think it's important to have a good routine. And yes, there are times you deviate from it, but that, for example, like you wake up and then you have your coffee and then you work out and then have your breakfast. I think sometimes having a routine is beneficial for maintaining good healthy habits.
Excellent. Thank you very, very much for that, doctor. And again, I think, and MA is back. So we've got another question. Welcome, MA.
Hi, doctor. Thank you again for that wonderful presentation. And I have a little question here. So I'm trying to get my blood pressure down. It's not terrible, but I like salty food, so it's kind of hard. I'm trying to not eat salty food. Okay, so in some of the presentations on the microbiome, they have said that fermented food is very good for the microbiome, one of which is sauerkraut. And I like sauerkraut, but it's salty. So left or right? In other words, do you not eat the salty sauerkraut because that's bad for the blood pressure, or is it okay, to improve the microbiome?
I think you balance it with the rest of your diet. So you look at the rest of your diet. If the rest of your diet doesn't have other things that are very high in salt, perhaps a small amount of sauerkraut may be beneficial and okay for you.
Excellent. Thank you, doctor. And I've got a couple more questions coming in. And this one is, I hope I pronounce your name correctly. Is it Xenia? Welcome.
Yes, it is. Yes, it is.
Welcome. Welcome. Thank you.
Thank you. It's very interesting. I live in Ethiopia. I lived in the US for 47 years. Then I moved back here. So I did some naturopathic studies in the USA. But anyway, so this is a good discussion. My question is in regards to high blood pressure. Do you test for the aldosterone levels when you do the blood pressure? One. The second question is, to lower the blood pressure, can you use the CoQ10, coenzyme Q10? That's the two questions that I have for you. I appreciate it.
All right. So when it comes to aldosterone, I think it really depends on the person. I get a basic metabolic panel to look at electrolytes and kidney function because that can clue into a problem with aldosterone and blood pressure. But as for checking aldosterone levels, I don't check them on everyone who has elevated blood pressure. And coenzyme Q10, yes, it does have some beneficial effects in lowering blood pressure.
Excellent. Thank you. And now we've got a question coming in from Elaine. Welcome, Elaine.
Hi, I was wondering if you could talk about the cardio IQ labs and whether those are worthwhile for healthy or patients that have compromised heart function, and how often should labs be done of that nature?
So the cardio IQ labs really drill down into particle size and check some other markers like Lp(a), which is lipoprotein A. And I really don't use them much if at all because they don't necessarily tell me a whole lot more about a person. They're not necessarily going to change the treatment that I would provide. I think that knowing something like what a lipoprotein A level is, knowing once whether somebody has a tendency towards that's an additional risk factor, and that might lead me to be a little bit more aggressive with that person. But in general, I don't use them a lot because we just don't have a lot of data on how to use that information.
Got it. Thank you very much for that. We've got a couple more questions coming in, and this one is from Janet. Welcome, Janet. Oh, I'm sorry, Janet. I didn't unmute you. Let's try that again. Hi, Janet.
Oh, hi. Thank you very much. I just had a quick question. If you have low blood pressure and feel kind of dizzy, is it okay to have some salt, or is it better to have something like kelp or nori or something like that instead? Or just wanted to know.
I think all of those are good sources of salt, but if you're lightheaded on a regular basis, you need to be talking to your doctor about why that might be the case.
Sage advice. Thank you for that. And we have a question coming in now from Ben, and welcome back, Ben. No, I muted you again. Let's try that again. Hi, Ben. Now we hear you.
Yeah, I'm sorry. Thank you very much for giving us the good lecture. And one my question is, do you recommend the people to take the multivitamin with omega-3? Multivitamin with the omega-3.
Okay.
Do you recommend? Do you just suggest the people to take multivitamin supplement?
I think it's a reasonable thing to do. Yes.
Okay. So take a multivitamin with an omega-3, right? You're saying it's reasonable.
I think it's a reasonable thing to do. Yes.
Excellent. Okay, great. Thank you very much for that. We have just a few minutes left, folks. If anybody out there would like to have this intimate opportunity to speak with Dr. Heather Shenkman, please go ahead and raise your virtual hand again. We are thrilled to take your questions. I wonder, Dr. Shenkman, I've just seen somebody close to me dealing with heart disease, had 5 stents put in, subsequently after that had a pacemaker put in, not the best diet. And ultimately, I guess my question is what do you tell people about dealing with the initial pain, the acute pain immediately after surgery? Is there anything that you recommend to people that they may not be thinking about? And does changing their diet help with that acute pain afterwards? I don't know if that makes any sense, but I'm curious about your thoughts.
Well, I'm a little bit unclear about your question. When you say acute pain afterwards, you mean?
I guess just post-surgery after getting stents and a pacemaker put in, folks are dealing with the fact that they're just in pain for a few weeks. I'm just wondering if there's anything you recommend that from a plant-based direction or something that might be a little more natural than what the hospitals are telling folks to deal with the pain.
You should not be having severe pain after the placement of stents or a pacemaker. I mean,
Okay.
A pacemaker, there is an incision in the chest wall. I mean, that may take a couple of days to heal up, but you shouldn't be having severe pain for days and weeks afterwards. So that's a problem.
So they would need to go back and see their doctor again. Okay, got it. Excellent. Thank you. Well, again, I would say at this point, it looks like we are, folks, anybody else got another raised hand? We've got a few minutes before we start our next. Oh, there you go. Jonathan took us up on this. Let me go ahead and unmute Jonathan. Hi, Jonathan.
Yes. Welcome. Hi, welcome. And thank you so much for that great presentation, Dr. Shenkman. I felt like I went through a science class again. Anyway, I have a quick question regarding exercise. So I see some people do intermittent fast sprint exercise, and I do more endurance. I swim 2 miles a day, 5 days a week, continuously. Which is better for the heart endurance long-term muscle, the intermittent workouts, those speed workouts and stop, or continuous endurance without stopping?
I think a good mix of both types of exercise is ideal. So
Okay.
not just doing sprints or just doing slow, long distance. Mix it up. That's what's going to be best for the heart.
Excellent. And to that end, obviously, some people are playing more with cardio. Some people are more into the weight training. Do you feel that one is better than the other for the heart?
I think both are important. If you can do both cardiovascular exercise and strength training, I think it's going to be ideal. Strength training does have some benefits, but if you really are limited on time, then do the cardiovascular exercise, make that a priority. But strength training definitely has benefits. It helps to improve our balance, our stability, our bone density as we get older.
Excellent. Excellent. Thank you. And now we have another question coming in for Aaron. Welcome back.
Yeah, hi. A quick question. What are your thoughts, doctor, about red yeast rice as alternative to statin?
Red yeast rice actually has a statin in it. It has a medicine called lovastatin in it at a very low dose. It also has some other things in it. It is a reasonable thing to take to lower cholesterol, but it certainly doesn't have the benefits that a statin would.